So today we're just doing a quickie on person-centred care. And so we can see here, what is a patient? This is talking about language, and the word patient comes from Latin, patens, meaning to suffer or bear. So the user in this term is simply suffering, while the healthcare professional has a title, and therefore there is an immediate imbalance of power. The patient in this setting is truly passive. So, when we use terms, we have to kind of think about, what is the interpretation that we're providing to others, and in particular to the people that we're caring for. So my most favoured terms that we hear, and I'm sure you've all heard this at the conference as well. People will have been talking about patient-centred care for diabetics. Yep. Or we look at a person and call them a schizophrenic. So they're not person-centred care, that's patients. We're looking at an illness, not a person. So are we seeing differences? And how many times do you hear about the non-compliant patient? Yeah? So these are contradictions in terms, because it's not a non-compliant patient, it's a patient choosing what it is that they want to do rather than being told what to do. So the definition of a person is an individual that has the moral right to make their own life choices, to live without interference of others. So in Australia, people that come to us are still in the patient role. Yeah, they come to general practice to tell us what's wrong so they can get their script and certificate and x-ray form, and off they go, come back for the results and get told what to do. Person-centred care is actually about bringing that person in and thinking about them and including them and everything around them. Yeah, if we're doing patient care, then we're not doing holistic care, and we're not doing person-centred care. So using a framework for person-centred care is a really good way to ensure that you're actually within a person model rather than a patient model, yeah? Because part of what we have to do is help the Australian community come out and start to be involved in their care as well. But whatever we call them patients, we'll never get there. So the framework is a really good way of giving you the evidence base for your care processes to ensure that all factors in person-centred care are taken into consideration, and it's also a guide for ongoing education, so you can see the areas that where you feel that you need more, and it's also a structure for evaluation. And this is the care process that I use in the framework, and this is McCormack and McCants from the UK. And they're very big in the UK. These guys have been doing a lot of work. The lights are blinding me now. And I love this model because, as you can see as well, there are three levels of it. So the first one is the prerequisites of the clinician. And then importantly, it's the care environment. Yeah? So we all know that the care environment can be difficult at times, and then it's the actual care processes. So to work in a person-centred model, you have to first work on yourself and then the work environment before you can fully achieve person-centred processes. We'll just look at each of those levels a little more closely because it's a bit hard on the wheel. So the prerequisites of the clinician is to be professionally competent. Are we professionally competent? Absolutely we are, aren't we? We're wonderful. We're very competent in our roles. Are we interested in learning more and expanding our competence? Absolutely, yeah. That's what I like to hear, because that's saying that already we're meeting the guidelines of the model. Developed interprofessional skills. What does that mean? bit of a fancy term for communication, really, yeah? So it's all about being able to communicate with people, patients, other clinicians, other nurses. You know, we have a lot of administrative staff as well, and a lot of allied health in general practice. So developed interprofessional skills, commitment to the job. Put your hand up if you're not committed to the job. It's just the amazement of general practice nurses, isn't it? No matter what, we are fully committed to our job and looking after our people that come. And these are the ones that sometimes we miss. Clarity of your own beliefs and values. Who could actually say what their core beliefs and values are? Who's actually sat down and worked that through and looked at that and looked at yourself as a person? So that you are knowing self. What's knowing self about? Can't see a thing. So this is about reflexivity, yep? Because what we have to think about, if you don't realise and you don't know what, you know, who you are and how you respond to people and the way they present, and then how they then respond back to you. This is the therapeutic relationship, yeah? And this is reflexivity. If you're not participating in reflection on your own self and your own practice so that you can learn more about yourself and why is it that I responded that way. You know, the day that the person comes and I think to myself, oh no, you know, just please not today, that would not the person I want to see. That means that I will then go home and I will spend a bit of time thinking to myself and reflecting on why was it that I did not, you know, feel on that day that I wanted to see that person? Why was that going to be a struggle? And that helps me learn about myself, but then helps me learn as well for the next time that I see that person. I'm not going to be like, oh no, not again kind of thing, yeah? So it's really important that we know who we are and what is it that makes us tick, yep? Who does know their core beliefs and values? It's a hard one. It is, it's really hard. Sometimes we even forget them as well, yeah? So if we look at the care environment, and I love this little picture, there is so much I think this picture says about general practice, but the care environment, it's a supportive organisational systems, power sharing, potential for innovation and risk-taking, the physical environment. And we still hear about the physical environment for general practice nurses, don't we? You know, is there actually a consult room where you can have confidential conversations? Do you have to move around all the time? Are you in a little corner? An appropriate skills mix. Shared decision-making systems and effective staff relationships. Is this something that we see in general practice? Little bits and pieces sometimes, and a lot of areas where we're not really necessarily good at that, yeah? So power sharing is an interesting one, because if we're a clinician that's working in an area, a facility where there isn't power sharing, it's unlikely that we will actually have shared decision making with the people that we're there to care for. Yeah, see how the influences can come across. Skills mix, appropriate skills mix in general practice. Yeah, I'm not so sure about that. I don't see that. I think general practice, often the nurse comes in and they don't even really know what it is that's going to happen. And then, you know, who is it that can help them learn? Yeah. And, you know, isn't the next nurse employed because we need skills in this area, or are they just employed because we have a vacancy? And sometimes it's just because we have a vacancy. So the care process itself, geez, it lost its animation. was really nice. It was one little circle at a time, hey, so that we could see it. So the top one, working with the person's beliefs and values. So, we've talked about our own. Do we know what actually is the beliefs and values of the people that we're caring for? Do we have time to know that? Not always, is it? Sometimes it's very quick in general practice. And if we're working with the person's beliefs and values, that's when we can actually engage with that individual. Engage truly with that individual as a person rather than an illness. How many times do the person's coming in for their diabetes care plan rather than their person-centred care plan? There's a large difference. And if you work from a person-centred model, you will find that people will engage more in their own care. Whereas if you're there doing a diabetes care plan, that's just a standard thing and you've got to go and do this and the doctor wants you to go and see these people. If they come back for a review, how many of those people have actually, worked towards their goals or been to any of the allied health? And that's because we failed this step of engagement. And part of the engagement is us talking with them about what it is and why it is that we're doing it. Have that 5-minute conversation at the beginning of a health assessment care plan or even a vaccination, a few minutes of why it's important, why we ask for this and why it is that we're doing it. And that gives people the feeling that it's all about them, yeah? And then when they get the call to come back for their review, they're coming back because they want to tell you what it is that they've done. They're proud of what they've done and they're coming back with questions. And that's what I particularly like. If a person comes back with questions or they say, I didn't go to see the exercise physiologist and gave me the reasons, that's wonderful because that's a person that's now sharing in their own care. Yeah, little signs. So the shared decision making, are we really, really doing this? Is that okay with you? Or are we asking the person, how do you feel? What do you think could help you in this situation? Yeah, rather than we think this will help you. So shared decision making is really dependent on the health literacy levels of the people we're working with. So a part of that is that we have to bring health literacy levels up so the person has the confidence to be a part of shared decision making. And a chap that I mentioned about yesterday, and it took almost 18 months from a person with a mental illness who'd been so pushed down and told that they had no voice, for him to 18 months of coaching and seeing him on a regular basis, for him to actually come in and say, I've been talking to my partner and we think that it would be best for me not to do this. And, I just jumped for joy. He kind of thought I was going to be upset, but I was so proud that he'd actually come out and made a decision for himself and had the confidence then to relay that to me. It was a wonderful moment. So you need to be really careful about how you interpret, and if you don't start here by knowing the person's beliefs and values, you're not truly going to engage and therefore you're not going to have shared decision making truly. You can superficially suggest that you're working there, but this whole process also takes time. It's about having the sympathetic presence as well and providing holistic care. And holistic care is another word that gets thrown around a little bit as well. And, let's go back to the diabetes care plan. So the person comes into the room and they've got a lot of things going on in their life, lots of different things, and we don't know any of it, and we just start talking to them about their diabetes. And that's not holistic care. Who's assessing mental health when they're providing person-centred care? If you're not doing, working with the person on whatever their needs are, not what the practice's needs are, or the doctor's, but what the person's needs are, then we're not really doing holistic care. And it's another term that gets thrown around a lot. Yes, I'm providing holistic care. But it's not, it's somebody's done this bit, that, and I'm the last one bringing it together. That's not holistic care either, yep. And a part of the holistic care, I think, that's the area where we actually do the collaborative stuff as well, and shared decision making. You know, it's beautiful. There's just this little tiny bit off the side there. It's beautiful, the consultations that I often have where the GP comes into my room rather than the patient going to the waiting room. So the GP comes in and it's a great opportunity for education, and the people just love it because they think, oh look, there's a whole team of them now. They're talking together and they're all talking about the same thing and with me, and they're asking me. But the beauty from the general practice nurse's role is that, you know, the GP comes in and you get to download, you know, this is what we've been talking about today, and, you know, we've come up with this is the, you know, area that we think will go down this track. How can the GP say no? Yeah. I mean, it's very simple. How can, you know, but later on, I'm not having a go at our GPs because I love GPs. They're amazing people and I love working with them. Their knowledge and wisdom's fabulous. So there's a lot to take in, but if we do the person-centred care, you can see we'll have satisfaction, involvement, a feeling of well-being, and created a therapeutic culture. So how do we implement person-centred care? I like to do it with the 4E strategy. As we've seen, it's quite complex and we need to start with one little bit at a time. In that care process, it's with the 4E strategy. Engage with the individual. So when they come for their care plan or health assessment, ask them what is their main health issue. And it is never the illness that you're doing the care plan for. 100% never. And if you engage the individual, that's where you will be able to educate using tailored information that suits their literacy level and where they're requiring or where they're wanting more information. When you can do that, you're empowering the person with the knowledge to enable them to make the informed decision about their own healthcare, or to enable them to work in self-care. So the 4E strategy I find is pretty easy: engage, educate, empower and enable, and I keep that in the back of my mind all the time. You don't always get through each of the 4 levels in each consultation, but at least if you're in 1 or 2 of them, yeah, then that's important. And engagement with the individual, let them know that you value them, that they're more than a patient, they're more than a dollar sign to the practice, they're a human being, they have needs, and that you're here to help them through their life. Thank you.